a Saturday afternoon protest in Belfast city centre. Those that are gathered here are from all sides of the community, and they believe that their political representatives have allowed a public consultation on a proposed health bill to be anything but public.
I think when you put something out to the public, the very nature of a consultation is it's meant to be a communicative process. It's meant to be interactive with the people that you're trying to reach. If it's hidden and no one can give an opinion, then the opinions of the people writing that proposal will be the only ones that are carried forward.
And people are incensed when they have seen what's in the consultation document, because it's proposing legislation that would result in people potentially being arrested, brought into hospital, have medical examinations performed on them, and possibly mandatorily vaccinated as well. So quite justifiably people are outraged, and that's why there's so many people here today.
After COVID lockdowns, people are worried that an enhancement of government powers may cause further problems for a society that is still dealing with the last pandemic.
We've seen over the last 4 years or so of lockdown that government overreach. They're trying to implement tyranny through lockdown, and we've seen the consequences of that. We've seen schools, children couldn't go to schools, and the mental health knock-on effects. We're seeing with the NHS waiting lists, whenever they close the country for only a couple of weeks to flatten the curve. That's went on for several years, and people operations, they can't see GPs anymore.
We did ask the Department of Health for comment, but none would be available while consultation was ongoing. Society is asking who's in charge and hope that public pressure will make decisions more transparent.
Our view is this bill should never even have got to this stage. On what authority did those in government, in the public legislation branch, in the Department of Health, what authority did they have to even put this through? This bill is in line with the likes of the Brexit and the likes of the Good Friday Agreement. It changes legislation. It changes how we're governed. So this has been ruled over, not governed with.
Dougie Beattie, GB News, Belfast.
Well, the Northern Ireland Department of Health previously said on this bill that Northern Ireland needs to replace outdated public health legislation that is more than 55 years old. We need legislation that covers infection and contamination from biological, chemical and radiological sources and brings us into line with the rest of the UK.